Imagine a person in a mental health crisis. Their ability to function is compromised, their resources are scarce, and their hope is all but gone. We all know people like this. People like Rita, valedictorian of her high school class, loved to cook and play cards. She was a draft board clerk during the Vietnam War. Now imagine mental health services that are unkind, poorly designed, punitive, fear-driven, and just bad for people. Services that make people hesitant to talk about what they're going through because of stigma. Processes that are too confusing, and no hope of brighter days ahead. I can imagine this because I've seen it firsthand. While none of us would want to receive care in a system like this, we have tolerated one littered with all of these traits. Fortunately, there's a better way forward. It's called love. And love will save our behavioral health crisis system. As communities grow, they have to find more ways to reach more people. And the way we deliver healthcare is no exception. Emergency services is a great example. Since the 1960s, the message has been the same for medical emergencies. What do you hear on your doctor's office voicemail? If this is an emergency, hang up and dial 911. That's right, or go to your nearest emergency room. The problem is, we've been sending people in a mental health crisis through the same system, and we hear that message on our therapist's voicemail too. But it wasn't designed for them. And so we're sending people through the wrong system, sometimes in handcuffs in the back of a police car on their way to a psychiatric hospital. Rita accessed a system much like this when she lost her will to live on the heels of a terrible auto accident and the loss of her job. She spent weeks on the psychiatric unit of St. John's Hospital in Detroit. She was banned from any interaction with her loved ones. No phone calls, no visitors, no letters. Some system, huh? Today, behavioral health crisis services have evolved into something that we refer to as a safety net, a set of services designed to honor the inherent dignity and respect that everyone deserves. Many communities have taken bold steps to address the needs of people in a behavioral health crisis. We have suicide prevention centers and call centers. We have mobile crisis teams, crisis residential programs, and more. All of these are designed to make the emergency department and the psychiatric hospital the last resort instead of the first one. And while these services work, they are not in every community. And people probably feel uncertain that you would describe these as services built on love. So why are we uncertain about love? It's because we don't understand it. In the English language, we use one word to describe many types of love. I love French fries. I love my boyfriend. I love the Detroit Lions. Okay, the Lions, maybe that's a stretch, but we have to decipher those nuances. The Greek language, by contrast, has 4 words for love: storge, philia, eros, and agape. Storge is a love of affection, especially between parents and offspring. Philia is a friendship love fueled by camaraderie and shared experience. Eros is a passionate love. Now, we don't need any of these loves for survival, and they wouldn't be appropriate in treatment according to ethical standards. But agape, that's the one. A selfless and dutiful love. It is love as an action. Where the other 3 loves are states of being, agape is a state of doing. So this is the love that should flow freely through our behavioral health crisis system. But in the words of the late great Tina Turner, what's love got to do with it? Well, I would say love has everything to do with it. You've heard platitudes about love before. Love is patient. love is kind, and so on. But allow me to offer some reflections from the pioneers that infused love into the crisis system we know today. Love is listening to understand. From 1940 to 1950, a tipping point occurred in the United States as more than 50% of homes gained access to a telephone. Just like that, people were connected. And Dr. Edwin Schneidman saw this potential impact. Dr. Schneidman realized that when people have phones, they can call and reach out in their darkest hour, and someone can be there to listen. Dr. Schneidman started the Los Angeles Suicide Prevention Center in 1958, and he later founded the American Association of Suicidology. Now, Dr. Schneidman didn't know who was going to call, but he still cared about them. And his work led to the development of hundreds of crisis call centers across the United States, serving people they've never met and caring about them just the same. That's agape. Love is bold. In 1971, the National Institute for Mental Health funded a research experiment where people with first ever symptoms of a psychotic disorder were placed either in a psychiatric hospital or a house. In this case, a Victorian house in San Jose, California. Now, there were no nurses or psychologists working here. Dr. Lauren Mosier insisted that no one work there that had a history of working in psychiatric treatment so as to avoid unhelpful bias. Instead, he hired empathic professionals who embraced the power of simply being with people as they journeyed through their psychosis. Being with. Talk. Sit. Listen. Mosier rarely used medications in treatment, and yet his outcomes were better than the control group that went to the psychiatric hospital. He had the freedom to act bravely in the interest of his patients. His work angered many of his colleagues. His research was suppressed for decades, but it led to the development of over 700 crisis residential programs in the United States. I am a product of Dr. Mosier's work. I was the supervisor of this crisis residential program, and while it was not the job I was looking for, it was one of the best things to ever happen to me. You see, I got to sit down every day with people in some of the darkest moments of their life. It taught me how to advocate for the people that continue to do the same work to this day. Love is caring more than you need to, longer than you have to. Can care without strings attached save a life? Dr. Jerome Motto dared to ask this question in the mental health crisis world. In the late 1960s, he devised a research experiment for people who had recently been discharged from a psychiatric hospital in San Francisco following a suicide attempt where they refused further treatment. Participants received a letter with a note. It has been some time since we saw you at the hospital. We hope you are doing well. If you'd like to drop us a note, we'd love to hear from you. Friendly outreach, no obligation. This was very taboo to work with these people at the time. You could liken it to talking about AIDS at the height of its epidemic. It was a very risky career move for Dr. Motto. So Motto and his researchers would drive to Sacramento every year to review death records to see if any of the participants in his study had died by suicide. And you know what? His experiment was working. The people in his study had a 50% reduction in the suicide rate. That's agape. Now, get this. Crisis residential programs like the ones that Dr. Mosier operated are using Dr. Motto's tools of care and context by sending postcards to people that recently discharged from their program. Here's one that was designed by one of the staff that also doubles as a coloring page. Great ideas like agape are timeless, but sometimes we dismiss them because they're old. I wonder if we would run strong towards agape if influencers had created it, or if Brene Brown or Drake or Bill Gates were extolling its virtues. How do we change that? How do we make sure that timeless ideas like agape never die? Suicide prevention specialist Dr. April Foreman once said that when you don't allow for new ways to care for people in crisis, the job becomes about avoiding litigation and high-risk patients instead of experimenting to find ways to help people who need it most. Here's what we can learn from the forefathers of crisis services. Listen to understand. Give doctors, nurses, and therapists the time they need to build substantial rapport with their clients. Don't overwhelm them. Would you be nervous if your nurse was distracted before they were about to give your child a shot? Would you worry if your doctor looked tired and fatigued before your surgery? Give them the space so they can listen to understand. Second, be bold. The entire behavioral health crisis system was built because people took risks that could benefit the life of another person. And finally, care more than you need to, longer than you have to. I think we're all afraid of losing our mind. But suicidal thoughts are not contagious, and neither is mental illness. We must lean in and allow agape to resonate through our system. Remember Rita? She lived a difficult life, but she didn't have to. I know Rita's story because she is my grandmother, a wonderful woman who I miss dearly. When we live out agape in our system, when we give people the care that they deserve, we can take pride in the system we've built, and the people that we're serving can take pride in living lives of meaning and purpose. Thank you.